Everybody has seen it. Everybody underestimates it. It has a clean, obvious progression. It matches perfectly with early, late, and crash. Pneumonia. Let's use our pipe analogy. Early, the lead. The pipe is not blocked. In pneumonia, the airway and the alveoli, it's mostly still open. Gas can still move. The patient might have a mild cough, chest discomfort, not pain, but chest discomfort. Slightly shorter breath with activity, but none too crazy. The water is still flowing. Oxygen exchange is still occurring. SpO2, it might be normal, might be a little low, but nothing too crazy. Now they might be a little shorter breath with activity, but at rest, they good. Mild tachypnea with exertion, little tired. I just don't feel good. The pressure is being maintained. In pneumonia, the ventilation and perfusion is still adequate. Now they might have a little tachycardia, low-grade fever. They look okay, but their body is working a little harder than they realize. Compensation, it's intact. Late signs. The pipe is narrowing. In pneumonia, the inflammation and that fluid is reducing the alveolar space. Now they coughing. And it's persistent and it's worsening. Pleuritic chest pain. Remember that chest discomfort? Now it's pleuritic chest pain. Audible crackles. Increased respiratory effort. Let's run it back. Inflammation and fluid. Reducing the alveolar space. Audible crackles. Increased respiratory effort. With the pipe, the water flow is restricted. In pneumonia, the oxygen diffusion is impaired. The SpO2 is dropping. New oxygen requirement. Or if they're on O2 already, an increasing need for the oxygen. Maybe the O2 at 2 has to go to 3 now. Shortness of breath at rest. Remember in the bed, we was cool a minute ago. Now we in the bed at rest and we feeling short of breath. Cyanosis is beginning to form around the lips, fingertips. The pressure is unstable. Compensation is struggling. We're in early decompensation. We got to increase work of breathing and increase cardiac demand. The tachycardia is not settling. Yes, mild. Now it's not settling. It's sustained. Anxiety and restlessness and decreased urine output. The pressure is unstable. Increased work of breathing. Cardiac demand. The patient is in early decompensation. The crash. Now the pipe's done busted in the house. Remember, in pneumonia, the pipe is blocked or has collapsed. The alveoli now is filled with fluid, debris, mucus. Ventilation is failing. Now the patient is in severe respiratory distress. They're using accessory muscles to breathe, and they cannot speak in full sentences. The water flow stops. That's the pipe. In pneumonia, the oxygen exchange fails. Severe